Hello everyone, my name is Salva, and I'm here to present this research done in Mential titled Developing a Symptom Framework for Data Therapies and Network Analysis. First, Mential is a startup business situated in the field of women's mental health, which focuses on developing data therapeutics through a mobile application platform in order to deliver personalized treatment to women, to treat those quality and health issues that may affect them. Data therapeutics or data therapies are clinically evaluated software as well as evidence based, which uses AI and multimodal data to personalize interventions. One of the main challenges that data therapeutics face is to define how treatment development should follow an initial evaluation of symptoms. And this is important for two main reasons. First, it's important for the diagnosis of the patient, given their symptomatic profile, and also it's essential for the development of more precise treatments. In order to achieve this, it's important to study the relationship between the different symptoms, to understand how they influence each other and how they originate and maintain mental disorders. Network analysis may help to achieve this, because network models interpret observed variables, called nodes, as elements which form a construct, and this allows to model the relationship between them. In the clinical field, networks represent complex systems understood as disorders, where symptoms interact, form groups, and influence each other. Mential can use the network analysis to study symptom relationships, that is, to analyze both the direct and indirect relationships between components, and quantify the intensity of these relationships. Also, to conduct structural and centrality analysis, which will help to identify the most influential symptoms within the network, and this can later help to plan treatment. Also, they can use it to identify treatment starting points, to determine which key symptoms should serve as foundational targets for detailed therapeutic interventions. Therefore, the objective of this study was to identify the symptoms that can be used as starting point for the detailed therapy. The test used for this analysis was the Brief Symptom Inventory 18, a tool used to evaluate psychopathological symptoms in both clinical and non-clinical populations. The test is formed by 18 items, 6 of depression, 6 of anxiety, and 6 of somatization, measuring a 4-point Likert scale ranging from 0 to 4. Data was collected using an online questionnaire from March 2023 to March 2025. 17,553 responses were gathered. Discrete statistics, missing data points, and outliers, as well as the presence of uniformity nodes and color bias, were explored. The resulting networks from the EVICLASO, GMOD Select, HUGE-MPN, and TMFG algorithms were evaluated and compared. The network obtained from the GMOD Select algorithm was the one selected and further analyzed, including the structure, after choosing the most appropriate algorithm to plot the network. The presence of redundant nodes using the Goldberger and unique variable analysis tests were also explored. The centrality analysis and exploratory graph analysis were done to assess the community structure. And finally, pre-hoc and post-hoc power and replicability analysis, as well as bootstrap analysis, were carried out to assess the stability of both the network and the community structure. 15,797 responses were the ones used to estimate the network in the end. 1,756 outliers were detected and were removed because it was considered they were a low number compared to the total, and also to avoid their possible influence in the results of the network. There were 538 missing values, which were around 3% of the total values, and it was decided they will be treated using the pairwise deletion method once the network was estimated. After the removal of the outliers, there were no substantial changes in the discrete statistics. Also, there were no problematic values of skewness or kurtosis, and all nodes were detected to be informative. The presence of color bias was assessed comparing the zero-order correlations network to the partial correlations network. As you can see here, the zero-order correlations network doesn't seem to have any negative correlations between nodes. However, there are some that appear in the partial correlations network. Given that there are weak correlations, regularization was applied to see if it will make them disappear. However, they were still there after the regularization. Therefore, they were further studied, and it was concluded that given the negative correlations were quite weak, and also the correlations with the positive correlations with the third node were also not very strong, that the possible effect of a collider bias won't be strong, and therefore no variable was removed from the analysis. Here it's presented the network estimated using the Gmod select algorithm with a sparsity index of 0.33, which means that it's a dense network, and that means that most of the variables are very interconnected with each other. Here we can already see groups of symptoms that are um, connected with each other positively and very strongly. First, we can see a triad here with the nodes of no interest, hopeless, and life, and also a triad with pain chest, trouble breathing, and panic. We'll see some dyads of symptoms like weak body and numbness, and sadness and loneliness. The multidimensional scanning algorithm using the spline method, given that it was the one that fitted the data the best, was used to plot the network. And this algorithm was chosen because it allows to interpret the distances, meaning that the closer the two nodes are, the more related they are to each other. And the more separated they are, the less related they are to each other. This showed interesting findings. For example, in red and orange, we have the symptoms of the depression and somatization dimensions. And we can see that they are fairly close to each other, which means that they are related to each other. Uh, and in contrast, we have the symptoms of the anxiety dimension, which are more spread out from each other. And even they are more related because they are more close to other symptoms of depression or somatization. And this already indicates that the symptoms of the depression and somatization dimensions seem to be more related to each other than those of the anxiety dimension, which are even more related to others symptoms of depression and somatization. No redundant nodes were detected using the Goldbreaker test. However, UVA detected two pair of nodes with small redundancy and one pair of nodes with moderate redundancy. Given the possibility that redundant nodes may alter the structure of the whole network, it was decided to reduce the network by computing the mean of the one pair of nodes with moderate redundancy and re-estimate the network again. Given that there were no structural or connectivity changes that were meaningful, it was decided that the network won't be reduced and will be left as it was previously. Centrality analysis showed that the most central nodes, that means the ones that are more frequently found in the network, were sadness, wordlessness, tense, and nervousness, according to all indexes. The exploratory graph analysis using the Glasgow-Walktraw algorithm, given that it was the one that showed the best fit indexes for the data, and they are presented here, confirmed the results from the multidimensional scaling algorithm explained previously, because it's suggested two communities of symptoms. A first one with all the symptoms of somatization plus panic, scare, nervousness, and restlessness, part of the anxiety dimension. And a second one with all the symptoms of depression plus fear and tense, also part of the anxiety dimension. And this indicates that the symptoms of anxiety are more likely to form groups of symptoms that are related and connected to each other, of the depression and somatization symptoms than with other symptoms of the actual anxiety dimension. The bridge centrality of this two community structure was studied, and it showed that the nodes with the highest values in all indexes were tense, wordlessness, nervousness, and fear. This is the final network, estimated with the GMOD select algorithm, with the two communities differentiated, and power replicability and bootstrap analysis showed that the suggested network and the two community structure were both replicable and stable. The clinical implications of these findings are that there are highly related groups of symptoms, as I've mentioned before with the triads and the diets, um, and therefore treatment should focus on each of these group of symptoms in a way that they are treated uh, together instead of individually. Also, the treatment of anxiety in an isolated manner doesn't seem relevant, given that anxiety symptoms are more related with symptoms of depression and somatization rather than with other symptoms that indicate anxiety. Therefore, treatment of anxiety should be coordinated with the treatment of depression and somatization. Also, um, those symptoms with the highest centrality and breed centrality indices uh, are interesting points to start treatment, given that the alteration of these nodes will have the biggest impact on the overall activation of the network and also on the activation of a larger number of nodes. However, it's important to mention the limitations of this study regarding causation, given that the network presented here is undirected and cross-sectional, given that the influence of the effect is not known. However, it's an important um, it's an important starting point um, to start studying these issues, and it can be further explored in future analysis. The application of these findings to data therapeutics are that it's important to focus on the most central symptoms, which connect both a larger number of nodes and also communities of symptoms. And it should be considered the interaction and the different type of relationships that anxiety, depression, and somatization symptoms have regarding treatment design. Thank you very much for your attention. Please let me know if you have any questions. And in the last slide, you can find some references that you may like to look into.